I'm going to admit everyone. Okay, so here comes all the folks. Hi, everyone. Thank you for joining us. We'll be getting started in just a minute here.
Okay, we'll go ahead and get started. Everyone's in from the waiting room, right? I got it, okay. Hi everyone, welcome. My name is Rachel Heller. I'm the CEO at CHAPA. And I just want to welcome you to our regional meeting in Worcester. For anyone new to CHAPA, our mission is to encourage the production and preservation of housing that's affordable to households with low and moderate incomes, and to foster diverse and sustainable communities through planning and community development. Our regional meetings provide us with an opportunity to share with you what it is we're working on, but also to learn from you what is happening in the region, where are your challenges, what is going well, what are the initiatives that you have taken on, and that really helps to inform our work and really the work that goes on throughout the state. So before we get started, we are going to take a moment for everyone to answer some questions about your work and about the current housing environment. So Whitney is going to go ahead and get our poll started. Hopefully you see it in just a moment.
Let me know if you guys should be able to see that now.
I don't see it yet. What about others?
Our CHAPA folks may not be able to. Mark, are you able to see that, others?
I have it.
Yes, I can see it.
Okay, great, great.
And Dana, are you able to move the slides so I can go ahead while everyone's filling that out? I'm sorry, my daughter's in the background. Dana, are you able to go ahead and forward the slides?
Hey, pretty girl. There she is.
While everyone completes the questions, I just want to take a moment to thank our sponsors. So we'll scroll ahead to that slide. Hold on, sorry about that.
Don't do anything, it's just a bell, guys.
Sorry.
Hi, what is your name?
Her name is Elise. Hold on.
Hi, Elise. Nice to meet you.
I want to thank. Okay, hold on.
The working parents on this call totally empathize with you. No worries.
It's either that or animals. It's either kids or animals. It's great.
So I do want to take a moment to thank Bank of America, our sponsor, who has for quite a few years now made it possible for CHAPA to do these meetings across the state. And I also want to thank our co-hosts in the Worcester area. So I want to thank Greater Worcester Community Foundation, Central Mass Housing Alliance, New View Communities, and RCAP Solutions. And thank you all for the work that you do every day to make sure people have safe, healthy, and affordable places to call home. With that, I'm going to turn it to Whitney and see if we've got our results. Are you ready, Whitney?
We're almost there. I can see that we have about 50% of us who've completed it so far. So I'll just give folks a few more minutes to answer as best you can. Don't worry, you won't be quizzed in that way, but we just want to get a sense, and we'll report some of the answers. So we're at about 60% and we'll end then.
And if we were in person, you know, this would be a much more interactive experience with all of us going around the room, saying our names, where we're from. But in this, obviously, in this new fun world of living through technology, we will use the features that come with Zoom.
Can you tell me whether you've received mine or not? I'm hitting submit. It doesn't seem to be going anywhere. It's Michael Moore.
I believe we did get that.
Thank you.
Michael. And for those who are finished, we'll just give a few seconds for folks to finish. And if you can, in the chat box, just introduce yourself, let us know where you work, live, or play, your name, while we wait for our last few numbers to come in. Okay, I think we're right about there. So I will go through, I will end the poll now, and I will go through some of the questions that we have here. So who do you represent? It's always so excited to see who is joining us on these calls. About 51% of you are from local community organizations. So that's really exciting. According to the second question, according to American List, what percentage of American renter households were unable to make any housing payments in May of 2020? And so let's see, I'm pulling up the information here. So 30% of you all, 41% of you all said 30%. So the majority of you all said 30%. And then second runner up, 33% of you said 50%. The answer actually was 22%. 22% of renter households were unable to make any housing payments in May of 2020. The third question, according to AmericanList.com, what percentage of American homeowner households were unable to make any housing payments in May 2020? Majority of you all said 22%, 41% said that. And then second runner up, 38% of you all said 30%. And actually, it is 22%. You all, majority of you all were correct in that. 22% as well. So in renter and homeowner households, 22% were unable to make any housing payments. Our next question, number 4, according to the Federal Reserve Bank of Boston, impacts of the COVID-19 pandemic on New England homeowners and renters. How many New England homeowners are at risk of missing the rent or mortgage payment due to coronavirus-related job loss? Majority of you all said 250,000, and then 36% of you all sort of said 500,000, and lastly 26% said more than 1 million. And the answer to that is, in fact, more than 1 million. Right? Astonishing results. And again, much of this information can be found on some of the resources that we'll be providing for you all, because it really does help in having some of these larger conversations that I know you guys are having on the regional level. The next question, according to the Federal Reserve Bank of Boston, impacts of COVID-19 pandemic on New England homeowners and renters report, under the best case scenario, how much in lost housing payments is likely to accrue in New England from April to July of 2020? Majority of you all said 500 million, 51% of you all said that, and 18% said 6 million, 23% said 1.42 billion, and then a few of you said 3 billion. The answer there, drum roll please, is $1.42 billion. $1.42 billion. And again, this information can be found on the Federal Reserve Bank's report, which hopefully, again, will drive much of the conversations that we're all having, these large, astonishing numbers. The next question, according to the MAPC update to the COVID-19 layoff housing gap report, what % of standard unemployment claims come from the following 3 occupations alone: food preparation and serving, office and administrative support and sales. And so from just those 3 occupations, is it 25%, 40%, or 60%? Majority of you all said 40%, 40%. And you were correct, 40%. Really outstanding in just those 3 occupations. So I'll keep going. The last question was really to kind of see how much of you all have been engaged in this process before with our CHAPA regional meetings. And so we're excited to see that the majority of you all, almost 70% of you all, have never been part of our CHAPA regional meeting. And so we're really so glad that you all have joined us on today to be part of this virtual discussion and actually seeing it as an opportunity area to get more of us engaged in this work. The fact that we can't come together, although we'd love to come together with you all. So on that note, I will pass it back over to Rachel at this time. Thanks.
Actually, now I'm going to hand it over to Dana, who will walk us through the agenda. Dana?
Thank you, Rachel. And thank you everyone for being on this call. I'm gonna walk us through the agenda and then we're gonna get right to it. So we're first gonna hear some regional updates from our partner organizations. Thanks to all of them for working with us to set this agenda and reach out to all of you to be here today. Then we'll hear a policy update from Abhi and Ryan from our policy team at CHAPA. Whitney will then walk us through a little bit about CHAPA's Municipal Engagement Initiative and how we're hoping to get more people engaged at the local level. I'll do a little bit of information sharing about some of the things that are facing your region. And then we're gonna do breakout discussions. You're gonna go into small group meetings with people in this meeting here today with some discussion questions. We're gonna ask you all to take some notes and share that back with us. And then we'll briefly come back together at the end of the meeting to share some upcoming meetings, events, and ways to stay connected with all of us. So why don't we get started right into our regional updates from our partner organizations. And so for our regional partners who are on the phone, if you can just unmute yourself when it's your turn to speak. So why don't we start off with Mark. I can see you right there. Mark Dohan is joining us here from New View Communities. Mark, do you want to unmute yourself and tell folks what you guys are seeing at New View?
Sure. So first of all, thanks for hosting us all today. Just a couple quick things. I would say that we've been surveying our tenants and watching our tenant collections come in, and I would say that we're doing better than the 22% of the households in the survey. So more of our tenants are able to make their rents payments at least through May. So that's good. Also, we recently opened up and completed rent up on Carter School Apartments in Leominster, and had a lot of help from a lot of people in the state, from RCAP Solutions, from many, just to get all those tenants moved in the midst of a virtual pandemic. It was great to see all the agencies coming together to help make something happen. That was really important, and to be a bit flexible in the midst of the pandemic. I would say the last thing is we also have been reaching out to all of our vulnerable clients, first-time homebuyers, et cetera. And up to now, I would say, again, they seem to be doing better than what the survey had. But I would say that our small business clients have been the ones that have been most impacted, and many of them are really suffering during this time period of not being able to open up yet. Thank you.
Great. Thank you, Mark, so much for sharing. Next, we'll go to Barbara Field from Greater Worcester Community Foundation. Barbara, did you join us on the call? I haven't seen your face yet, but I think you're here.
I'm here. Actually, on my screen, I'm
Barbara
right.
Field, there she is.
I wasn't quite prepared. Anyhow, I've been the CEO and president now for 10 months at the Greater Worcester Community Foundation. I've met some of you, and there are many more of you I've yet to meet, but my background is steeped in CHAPA, and a longtime fan of CHAPA from years in Boston, years in Rhode Island, years back in the region, and now here in Worcester. And I just wanted to welcome everybody on the call to this event as well. For those who are new, and there were so many new people, which was very exciting, I think CHAPA can really serve as a terrific umbrella organization from everybody involved in housing. That's what I've always appreciated. You're great on policy and being the big tent that we always talk about. You guys actually do it and do it really well. So thank you. So the foundation has been focused on the pandemic and COVID-19. Jonathan Cohn is on, who is our VP for Program and Strategy. Some of you know him. Obviously, we have funded housing in the past, but in the pandemic, we have raised over $8 million together with United Way, and housing has been one of the main focuses in the emergency phase. We expect to have 3 phases of our funding. The emergency phase has been ongoing since the beginning, focused on food, housing, and health, particularly mental health, and setting up telemedicine and all the impacts involved with that, and shelters as well. We are moving into recovery as well. A number of the housing groups we'll be talking with as they think about how to deal with the future, and then reimagining and rebuilding. And in my mind, that is about breaking silos and how all of the pieces go together. The housing, the access to schools, health, et cetera, that is part of comprehensive community development. So we'll be looking for some ways to work with organizations as we figure this out. Although I do think on the housing one, I guess everybody's saying things, and you could see the reports from the Federal Reserve, things will probably most likely get worse as unemployment stays high and people are unable to pay their rent or mortgage. I think I guessed wrong on some of those, so I would love to go back and look at that data. I do think it's something that will be compounded over time. And of course, here in New England, I come with a historic bent. We have the oldest housing stock in the country, and so people are already living in unsafe, unhealthy conditions, and the connections between health and housing are real and will only be deepened in this situation. And I think I'm excited to be new in the area with UMass Medical and UMass Memorial. I'm hopeful that their ability to build even stronger connections and that we can play some small part in that. We have also been involved in trying to deal with housing the chronically homeless before the pandemic as a creditor in a citywide program led by the city manager and Dr. Castile. And many of you on the phone have been involved with that. And we got a little bit of an update earlier today. I attended my first interagency housing meeting. So I'm both here to tell you a little bit about what we're doing, but also to listen and learn and to meet many new partners. Some like Mark I've known for years from different phases in different parts of my career, but I look forward eventually to knowing all the faces here. And I know I've invited one of our newer corporators who's with one of the local banks and trying to expand the tent and include those who finance and support the work that all of us are doing to get housing built and preserved.
Thank you so much, Barbara. And we're really excited to have you in Worcester as one of our partners. And thanks for the kind words to CHAPA. We really do see ourselves as that. And that's what I hope this meeting here today can be, that umbrella conversation to bring everyone together. So we'll go next to Atel Hajii from Central Mass Housing Alliance. Atel?
Awesome. Thank you, Dana, and thank you, CHAPA, for the wonderful work that you do and for bringing us together in Worcester. Super excited for this conversation. I'd like to share my time with my colleague, Gina Platanino-Nino. She's a staff attorney at Central West Justice Project, also known as organizer extraordinaire behind the Worcester Together effort. So I'm going to pass it to Gina, and then I'll fill in the rest of the time.
Hi, Atel. Thank you for the introduction. Thank you for having me. We're in Worcester. We're very fortunate to, like Barbara said, work with so many agencies to help alleviate some of the homelessness issues that we have. And some of the things that we have been doing is trying to make sure that a lot of the resources that are available are known to our community. We know that language access is a big issue. We know that a lot of these programs seem to be like a well-kept secret, not intentionally, but it's just the way things are, especially now with agencies being closed and more difficult to get. So one of the things we've done is create PSAs, made them available via radio so that people know that they could have access to RAFT. We work very closely with the programs issuing LIHEAP, work very closely with CMHA, with RCAP, making sure that all of these programs are widely available. and not only letting people know what the resources are, but also creating resources for other people. So we worked on making sure that, like, at least, for example, in our area, undocumented folks who don't have access to unemployment or other things like that could have small funds in order for them to either rent and other things that they may need. One of the other things that we also are working on is to make sure, and Atal will touch upon this a little bit more, is that there's Worcester, as everyone knows, we have a very large youth homeless population. None of this was new, but because of the pandemic, it was exacerbated. So Atal will touch on the women's shelter that we worked on and another exciting project that we worked on. But I also just want to highlight the relationship that we have with our housing authority. I know Alex is on the call, but when we think about housing insecurity, it's not in a silo. It also goes in hand with financial insecurity and food insecurity. And one of the first things we did when COVID hit is to make sure that at least our housing authority had the resources necessary. So that would have been food deliveries across the city. We also have hot meal programs to ensure that these very vulnerable populations that don't have the safety net of extended family or nice employment packages also have these resources. Making sure that they can stay home and making sure that the resources are widely available for them. And I think Atal can just fill in on the other things that we've been working on in our area.
Thank you so much, Gina. That was wonderful. As Gina mentioned, part of what we're seeing on the ground in Worcester is, it's sort of what I've been saying is the collision of two things, right? We have the chronically homeless population, and I don't know if Dr. Castile, our Commissioner of Public Health, she deserves a lot of credit for putting together a good model for how to bring resources available to chronically homeless individuals. And at the same time, we are seeing that our homeless families, both in shelter and also what I'm calling sort of the new wave of doubled up families that we as providers and organizers on the ground knew that this problem existed. COVID has exacerbated it, which has led to the providers sort of filling in the gap where a gap that was potentially could have been filled by the state in terms of infrastructure and resources. We're super grateful to our Greater Worcester Community Foundation and the fund for being able to fund two important projects that I'm going to very quickly summarize. One is that we soon realized that, unaccompanied women, chronically homeless unaccompanied women who have been deeply traumatized by being on the streets, by being in abusive situations, they deserve a different response. And so having them in co-ed shelters, we soon realized was not the safest option. So the group of providers that Gina and I and others were part of got together, help from 70 Hills Foundation, created essentially a temporary shelter for these women to receive services as much as possible, and then to have a plan for rehousing them. So that's just been one effort. Another effort, thanks to, again, the Greater Worcester Community Foundation, we were able to, again, talk to families that are doubled up in situations where they are not able to stay where they are because of exposure, or simply because COVID has just exacerbated the issue of housing, and found a place for them, a temporary space, a respite for 60 days. I just came back from meeting with half of those families. And I can tell you the number one thing that they mentioned is, thank God that we have a temporary safe place to put our head on the pillow so that we can think about the next steps. And the next steps are not going to be easy in any way. The issue of affordable housing, I'm sure we're going to hear all over. This conversation doesn't just relate to finding affordable housing. I just want to bring up the issue that as a former climate justice organizer, we're having a housing crisis, a health crisis, and a climate justice crisis. And housing needs to be not only safe, it also needs to be sustainable and climate resilient. So I just wanted to lift up that issue. And the last message that I want to leave you with is that the magic of all the providers and folks coming together in Worcester has been that we have been able to put together resources, and it's not enough. This is not something that it can be sustainable. And so I think that we need more robust conversations around how we're going to expect the new wave of what we know are going to be newly homeless families and individuals, to make sure that they have a safe place to be in the weeks and months to come.
Thank you so much, Atel and Gina. I really appreciate your perspectives and sharing all of the great work you're doing and thinking about in the future. And lastly, we're going to hear from Karen Kohler from RCAP Solutions. So Karen, you can go ahead. Thank you.
Well, I love being last because I can wrap it up very fast. First of all, I just want to mention off the cuff of Atel's comments, RCAP Solutions, as you know, does a lot of different things. We don't just do Section 8. We don't just do homelessness prevention. We do share RAFT and all of the housing counseling, but we also have a very large entity within our organization that works across all small communities, usually rural, but small communities. So in our catchment area, which is Worcester County, there are 3 entitlement cities and everybody else is considered non. There's a new program coming out of DHCD. I think it's going to be actually rolled out within the next 2 weeks by July 1. And it's going to be connecting CBDG money with those non-entitlement communities that need assistance. I'm going to call it a super RAFT program. It's really called IRMA, but we will be administering that. And I think that that's going to be, it changes the dynamic of who's eligible for the existing RAFT numbers, and it brings them up to almost 80% eligible, which we've already seen a great deal of interest on homeowners. So I'd like to just touch on that. A lot of the work that we're doing, we were very fortunate to receive a $2 million Synergy grant from the Health Foundation in Worcester. And the work for that is on home ownership that have well water issues. There's a lot of water problems, so it goes to what Atel said about safe. Safety in housing is just as important as having potable drinking water and being able to be sustainable. RCAP Solutions has a unique presence in this regard, and I don't think it's well recognized, so that's why I'm introducing it here, because we do a huge amount of work, federally funded through USDA, EPA, et cetera, on water within the communities. And we're reading more and more about how communities are having issues with safe drinking water. So for any of you on the phone that actually have properties, we can also do testing. Many of the senior properties in the area that have their own well water do not have well-trained water operators. And there are a lot of properties that have contaminants within their water system. So that's a niche that RCAP Solutions has and is recognized on it through the National RCAP program. I wanted to mention one other thing, and I think that it's about inventory. And because RCAP Solutions handles we handle the Section 8 vouchers for for-profit entities primarily. So the nonprofit, obviously Worcester Housing Authority has about the same number of vouchers. We work in independent areas with landlords. And so what we know, and I'm not sure that Worcester or Worcester County really appreciates, I think Barbara mentioned the old inventory of New England. There's a lot of old inventory, and what we're seeing when we go out to do inspections is that there are 3-deckers, like in Fitchburg, Worcester, you can name it. All these other communities, they were all manufacturing communities that grew up many, many years ago. And they had 3-deckers and oftentimes owner occupied. What we have is an aging out situation where the owner occupied is maybe a widow. She's living there safely or hopefully safely, but not interested in being a landlord again. So there is and I don't know what the number is, but I just want everybody to think about this. When we're talking about creating housing and more units, it does not mean that all the units in Worcester County are filled. and they're not filled primarily because they have older owner-occupied residents. So it could be that we're sitting on a much more lucrative inventory than we think. So I think that something should be done to try to figure that piece out and offer assistance to owner-occupied. Most of them are widows, but some of them are widowers, but it's the aging out process, and they don't want to be a landlord anymore. So they've got 2 layers above them that are empty. I think it's a big issue. The other thing I wanted to mention is we've seen an uptick in foreclosure prevention with single homeowners. That's through our HUD counseling, and we also are entering into an agreement with New View, which is very exciting. But foreclosure prevention at a different level are people that we've never seen before through our Housing Consumer Education Center or through any of our housing programs. So there's an uptick in a different level of income. There's an uptick in people that may have never, ever thought that they would need public assistance. So a big challenge to this is to have people know to come in the door, because whether it's unfortunate or fortunate, you decide. But some of our programs are considered for low income. And so when people say, well, I'm not low income. Well, maybe you are now, but you weren't a year ago. And there are programs now that are going to help people that are of middle, even higher level incomes to maintain their homes. And I think that especially with this new program that's going through DHCD, it's going to be 80% of their total income, which is a much higher level.
While you're on that topic, a couple of folks in the chat have asked questions. The program, you called it Super Raft or IRMA. Can you say again what that program is and a little bit more about the CDBG funding and how folks could access that? Because we were getting a couple of questions on that in the raft or in the chat.
Wow, that's great. Except I don't have all the answers.
Okay, we'll share some links too. But what you can share.
I'm going to say that as of yesterday, they're still crafting all of the appropriate requirements. But what we're trying to do through DHCD, and that's not RCAP directly, but we're a secondary, DHCD has actually blended their community development side of the house to rental assistance. And this is very unusual. So the CBDG money that many of us know go into communities for affordable housing, whatever, is now being married to a RAFT program that the governor has funded. It's a $20 million pot of funds. We have not gotten our final information on how much RCAP will have for funds, but as you know, we're one of 9 across the Commonwealth, so we will get our fair share. I am happy to, once the regs are out, then I'm happy to share them. But because DHCD does not have the regs finished up, and there are a lot of encroachment issues with this, you know, this is not an easy handshake. There's a lot of entities here that need to come together. And in addition to that, some communities are deciding to do their own Section 8 RAFT program, which then bypasses the process that has been created by DHCD. So there's just a lot of stuff. I don't mean to be taking you off course, but
that's okay. And I think that
I want to give you all the information because these programs are rolling out almost every day. There's more and more money coming through. You know, RCAP is handling a lot more, as is CMHA for RAFT. You know, we're getting more and more funds, but now the issue is, what is the proper way to delegate the funds and manage taxpayer dollars to the best of our abilities?
Great. And we will be hearing from Avi from our policy team, and she'll speak a little bit to this as well. So I really appreciate all of you as our co-sponsors raising the issues that you are all facing in your region. We will now go to, and I should mention, if folks have questions, please ask them in the chat. We will make sure to try to answer them during this session. If we can't answer them during the session, we will follow up with you and share materials after. So we're going to go over to Abidnia Curve, who's our from our state policy team at CHAPA, to give us some updates on what they're working on.
Thanks, Dana, and hello, everyone. Thank you for joining in. Speaking to all the issues that we have been hearing, CHAPA has been working on a lot of priorities on the local level, with Dana, heading that effort, but also on the state level and the federal level, in order to ensure that people have a home during this crisis time, and also making sure that whatever policies we are advocating for are equitable and ensure that all residents have a safe place to call home, call it their home. We are working not just on the renter level, but also making sure homeowners and landlords have some support in order to maintain the housing, the properties, and also make sure that our housing system and our communities are stable as we try to recover from this crisis, and also address some of the issues that were persistent even before we came into this whole COVID crisis thing. And so with that, we, if you can go on to the next slide, Jan. With that, we have some priorities lined up, and today I think I only have time to talk about a few of our focus priorities. We have a lot more going on than what is up on the slides, but one of our main things that we have been working on is expansion of RAFT. As Gina and Karen pointed out, that RAFT has been really sort of the main housing assistance program, providing housing assistance for people in Massachusetts, and especially for populations that are not covered under any of the federal assistance that has been coming in, especially undocumented immigrants, and many people who have not been able to access the federal assistance. And so from our preliminary data, we have come to the figure of 50 million in funding for RAFT, and this is just still the starting. As we go ahead and as we see that the moratorium ends, we might see a really spike in calls for RAFT and applications for RAFT. You're already seeing through the Housing Council, through the HCECs, that there has been almost a 200 to 400% spike in applications for RAFT, and that is where we see that as the moratorium ends, this is the program that will help keep renters sort of, housed safely. As Karen talked about, there is a program that DHCD is working on, which is sort of a RAFT-like program, but reaches to a higher income population. What we are advocating for now is for RAFT to be expanded up to 80% AMI. It is currently up to 50% AMI, and in whichever way DHCD and the administration wants to do that, we are fine. But the point is that it needs to reach up to 80% AMI and ensure that people below 30% AMI are also getting enough assistance. We did have a webinar on RAFT, and I would be happy to put up the links for that, where we did talk a lot about what is the program currently and how are the funding streams, because right now there are the COVID funding stream with the governor giving out 5 million for COVID response for RAFT, and then there is the traditional funding stream. So there's a lot going on in there, and I would encourage you to, if you want more information, you can go on the website and check out our materials on RAFT. We also have put out a letter to the legislature and the administration to advocate for 50 million in appropriation in whatever way it is done, either through a supplemental budget or through the main budget or through separate funding. That is up to the legislature, but we do want to see 50 million pouring of funds into RAFT, and also the HCECs, which are sort of the frontline agencies that are giving out housing assistance and counseling, more funding so that they can be staffed enough and make sure they are able to provide those services to residents. That is what we have been asking. At the same time, one thing that we are seeing is, as we try to expand what state funding we can use, what we do realize is there is a lot of federal funds coming in, and we need to ensure that those are directed to programs that are really helping residents and that are going to be helping with rapid rehousing and also other things like shelter. So CHAPA has been working on trying to get our members together and make sure that we are putting out something as we coordinate our federal resources and make sure there is a public input process in that. I would be happy to put up some links as I finish my talk to, as we are making sure that not just on a state level, but even on a local level, if we can get some input into what is the decision-making process and how can there be a public input in that process. There's a letter that we have drafted that you can use to reach out to your municipal officials and ask them to, have a say in that, have a voice in that conversation of making those decisions for appropriating the federal funds on the local level as well. And with that, there is also another legislation that is not mentioned here, but certainly a priority of ours, which is the Right to Counsel. The Right to Counsel pilot program is something that is filed by Senator DiDomenico, and as the moratorium ends, we do expect that there will be a lot of evictions that will be filed, and a right to counsel in that case will be a really, really helpful process to make sure that we have some balance there, and the evictions are not amounting to a lot more than necessary. So we that is one of our priorities. I'll be posting a lot of links as I finish my talk. Going on to our budget priorities, we have always been working on a whole list of priorities for housing programs, including mass rental voucher program, AHVP, and things like that, which we will be advocating for. But at this time, the state budget process is not really an established process under these situations. And so there may be either a quarterly budget or a monthly budget. And we are, but on our part, we are trying to advocate for our housing programs to be funded at the level required, no matter how it is done. And so in that sense, the governor has already filed a supplemental budget, which reauthorizes FEMA dollars to be used for many host of things, some of which is public housing authorities. They have already spent a lot more than what is expected for keeping up their properties and making sure there's sanitization and other things to ensure social distancing measures. And so in the supplemental budget, we'll be advocating for the 13.5 million for public housing authorities and more for homeless shelters, so that they can be for depopulation of shelters and for a lot more things that they have been doing. But also in the main budget, we are going to be advocating for 135 million for MRVP and AHVP, and also for permanent supportive housing for people experiencing homelessness. And these are some priorities that we have sort of realigned for the COVID response. Some of them are same as before, but we are also trying to keep an eye on the priorities that we had before COVID hit, which is our housing choice legislation. And one thing that has helped sort of drive it forward right now is, as people are talking about the whole racial inequities in many areas, and as we are trying to come to terms with what is happening and people really want to do something, this is the opportunity where we sort of are trying to push forward the housing choice legislation by connecting the dots in terms of how how cities and towns are segregated because of zoning, and how, if we want to do something about it, this is the legislation that we can support, and we have been simultaneously working on that. There's a whole host of other things. I would encourage you to see our pages on CHAPA priorities to get a sense of what all we have been working on, and I'm happy to talk about any more questions that you have regarding this. And I think I'll pass it on to Ryan first for the federal part of it.
Well, thank you, Abhi. I'll just piggyback off of that. So again, I'm Ryan Dominguez, Policy Analyst at CHAPA, and I help to coordinate the New England Housing Network, which includes affordable housing organizations from each of the New England states. And together, we've been advocating during the COVID-19 crisis for a number of different housing and homelessness resources down in DC. This can include, housing and homelessness funds for the next kind of stimulus package that may come out from the federal government, as well as some, regulatory waiver flexibilities for the current programs that we have. And we've had a number of different letters and calls go out to HUD and the Treasury on those types of things. But, outside of those efforts, I think we're really focusing and turning our attention to advocacy on both the state and local levels to ensure that some of the funding that came in through the CARES Act will actually be allocated towards some of our housing and homelessness needs. So to give an overview, we have focused our federal advocacy on the state and local level on 3 sources of funding. The first is the Coronavirus Relief Fund, or CRF. The second is the Community Development Block Grant, or CDBG. And then lastly, we focused on the Emergency Solutions Grant, or ESG. So the Coronavirus Relief Fund is the largest kind of pool of money that the state has received. And other states have used this funding for things like emergency rental assistance. In total, Massachusetts received $2.7 billion for their CRF, and they have allocated approximately 25%, around $502 million, to go directly to local cities and towns. To highlight a few of your municipalities, Worcester received around $16.3 million in their CRF fund, and Leominster and Fitchburg each received around $3.6 million. So that's a good pool of money that can be used for things like rental assistance. The next pool of money, like I said, is the CDBG grants. And you can use these types of funds for 3 months of rental assistance or funding, different housing counseling programs. And of the total that Massachusetts received, they received $86.8 million in total, and $40 million of this went directly to entitlement communities. To highlight some of those entitlement communities, Worcester received $2.7 million, Pittsburgh received $586,000, and Leominster received $272,000. Lastly, there's the ESG grants, which can be used to support shelters and fund rapid rehousing. The Commonwealth received $104 million in total, and close to $60 million of that total went to entitlement communities, and Worcester received $4 million in ESG money. I will add 2 documents that outline how much each of the cities and towns have received in all of these different funding sources to our chat box, so you can, then go on and try to advocate with your local municipal elected officials and your state representatives to try to make sure that you are a part of this conversation and to really fight for housing and homelessness kind of relief to be included. Rental assistance will be at the key as a key component in all of this, and we're working on a proposal right now with the state for coronavirus relief fund money to go towards rental assistance. We're looking at a figure of around $100 million, and as Abi had mentioned earlier, there's a right to counsel pilot program that is being proposed right now, and we're going to recommend that the state put $6 million of their coronavirus relief fund money into that. And there'll be other components of that proposal, so be on the lookout for that letter that goes out. So I can kind of open that up to questions if anybody has anything, but our next slide is, what you can do now in your local communities.
And I would say that one thing that we definitely, want to advocate for and make sure that if you can reach out to your legislator and advocate for the 50 million for RAFT expansion with 6 million for HCECs, that would be a great thing. We have a sample letter that you can, send your legislators to ask them to support that request, and also make sure that all the federal money that is coming in is in many ways appropriated for homelessness relief. You can also contact your local and municipal officials and decision makers to be engaged and offer input and help organizing for the federal money that is coming in into cities and towns. And also we are working on a response specifically for ESG to be diverted for rapid rehousing and shelter funding, and please stay tuned for that. And I know Caitlin Golden from Mahasa would also be a great person for that. You can also join our committees where a lot of these discussions are happening. We have a Building Blocks Coalition, and all those committees can be found on our CHAPA pages. You can join those coalitions, sign up for them, receive updates, and participate in those talks where we sort of discuss these priorities and how we are going to go forward with the advocacy. You can join our many other communities which are focused on committees focused on homelessness prevention, public housing, rental assistance, where we would love to hear your input on how to go about the advocacy for these things and what would be the programs that we need to really fight for going forward. So please be engaged, and if there are any questions, please let us know.
Thank you so much, Abi and Ryan. just a reminder, this is a trick I learned about Zoom the other day. In the chat at the bottom next to where it says file, there's 3 little dots next to each other. If you click on it, you can save the chat. So before you log out of this meeting, if you're all furiously trying to download all of these materials, don't worry. First of all, we'll be sharing all of this stuff, and most of it you can access on our website, but you can also save that chat before you log out, and we'll also be sharing these slides. So thank you very much. I love this "What can you do now" slide. I think we'll print it out and deliver it to everyone so that everyone knows how to get engaged. So I saw one question in the chat about how folks are doing stuff around first-time homebuyer education and resources. I know a lot of classes are being offered online, and Elizabeth Palma-Diaz at our office is the person to connect with. I added her email in the chat. And then also some questions about comparing budgets from year to year, and I believe that stuff is available on our website. Is that correct?
Yes, one thing I'll say is that we are working on a lot of these things because these things are happening at a really fast pace. And so we are working on updating because initially we had like some requests and then we realized no, 2 million is not enough. It's going to be 4 million. So we are working on updating those requests. But most of these things are available on our website under CHAPA budget priorities. And so I did post, I think, our budget priorities chart, which had like the comparison of different years.
Excellent. Thank you so much, Abhi. So we're going to move on now to a little bit about what our municipal engagement initiative, because I know many of you are new to this. So Whitney's just going to spend a few minutes helping you understand what it is she and I do every day. And so take it away, Whitney.
Thanks. I'll try to be as quick as I can because I really do want to use a lot of our time in our breakout sessions to hear from all of you all. But thank you, Dana. It's great working with many of our colleagues on the policy level who are working rigorously, as you can see, on the federal, state, and local policy work. And so with the Municipal Engagement Initiative, our efforts are really to go into communities and really build support for affordable housing production. Understanding the fact that local support can really make or break housing projects. And so we are sort of active in working with local strategies. One thing we know for sure is that each community, one thing that is similar about every single community that we've gone into is that each community is unique, right? And so they have their own particular strategies and oppositions or concerns or challenges, different expertise, different sides of government, etc., right? And so in our local strategy, we really work to support the efforts of each community to sort of build a culture that welcomes housing and including affordable housing for sure, right? As in this moment, we're really seeing how, again, how housing is healthcare, and you know, and more than ever, we're really sort of, as a state, bolstering our efforts to expand housing opportunities in the communities that are safe, affordable, accessible, sustainable, all of the things that my colleagues and friends have mentioned prior to my talk. So our efforts really is to grow the number of people supporting housing production in each community. And so right now we're in 9 communities, including Amherst, Acton, Arlington, Medford, Essex, Newton, Foxborough, Revere, and Lynn. And as you can hear from some of those communities, they're all very different. And we're also in 2 of our MEI-like communities, in Agawam and Brookline. And in our MEI-like, we're sort of in a less intensive way working with those communities, sort of a lighter touch approach. But again, we encourage you all to look at our MEI Lite toolkit on our website to get examples and samples of sort of how to do this work, right? So many of us are asking ourselves, how do we get started? Where do we go? All right, so much of the work is happening, I think, as Gina mentioned earlier, in silos, right? Folks who are supportive to this. How do we build a network, a coalition of groups of folks who understand this work and want to push these efforts forward, right? So first we talk about identifying who your core are. Who are the people in your local community that are sort of driving these different efforts, right? What are some partnering organizations you can work with that sort of expand outside of just housing, right? We understand housing is healthcare. How do you bring some of the folks in community health centers or hospitals, et cetera, into the conversation? How do you bring religious groups and civic groups into the conversation, thinking outside of just the normal folks who are having these conversations, and then begin to have them in one-on-ones with folks to really expand the idea about what work needs to happen locally, what are those concerns or challenges in your community, and what things you'd like to push forward. And as we shared some of the data we talked about, do a data dive, leverage the moments that we're in, right? Where, like Avi said, we are really in a moment of some sort of dual crises, right? In terms of healthcare, as well as some racial implications, right, in our society. How do we lean upon some of the moments that are happening, diving deep into the data and sort of launching the efforts to really expand the conversation, right? So get started. I think the main thing is to not have fear and to kind of get started in the work. Once you've sort of had those conversations and bringing folks together, launch an event or a meeting, begin the process, and sort of start to think about then who's not in the room, who have you not captured, how can you expand it, how do you make it more accessible, think about when do we meet, where do we meet, who are we meeting with, how can we expand that. And I know that's all a lot, but what we've done is we've really put together a toolkit on our website for our MEI Lite, which really does give sort of a guide in terms of how to get started, talking about some of the strategies, how to think about who stakeholders are outside of the normal folks who come together. And really the effort is to rally supports of groups so that when there is a project that comes down, you can really bring support around it. If there's a policy you want to move forward, there's a group of vested individuals to get it done. So wherever folks are within the process of where they are, it would be great to have a group at whichever stage to kind of bring these things forward and to have a more healthy, affordable, accessible housing for all. So that's really the goal. I think the next slide is Dana talking about a deep dive in terms of the data and the context of where you guys are. And again, each community is unique. And so we encourage you all as well to tell us where you live on our website as well, so that we can help to connect you all with folks who are interested in your community to do some sort of coalition work. So we're happy to be helping and facilitating in that. On that, I'll pass it over to Dana to talk a little bit about what happens in Worcester and Central Massachusetts.
Thank you so much, Whitney. So I want to, the next thing on our agenda after I speak is for you all to go into our breakout room. So wanted to just give a little bit of context. It's been really helpful to hear from our state policy and federal policy and local engagement, and then our partners in the Central Mass and Worcester area. And I just want to give a little bit more, so when you go into your conversations, you're all talking about the same thing. So just quickly, these are all sources from reports that Whitney had mentioned in the beginning during the poll. Just want to share a little bit deeper here. We've been hearing a lot about, what are communities or what are cities going to look like after coronavirus. And one of the places that we've been looking for data is through the COVID Community Data Lab. This one resonated with me in particular. You can see Worcester on here. There's a little dot right in the middle that cities with more crowded homes are being found to have higher COVID rates than those that are just dense communities. And so I think that's something important to think about. I think Etel specifically spoke about doubled up families and people having to be in situations where they're crowded. So Worcester has a case rate of 264 people infected per 10,000 residents as of June 3rd, an overcrowding rate of 3%, which is actually somewhere in the middle. The other things that are correlated with coronavirus that I just want to mention is 46% of residents in Worcester are frontline workers, 44% are residents of color, and 21% are households in poverty. These are all things that are related to higher rates of coronavirus. So I just want to mention those as you're going into your discussions. Obviously, everyone is struggling in this environment with making their payments, and Whitney mentioned the rates of renters versus homeowners. If we dig a little deeper, you can see that lower income households are having a harder time making their full or partial payments. And I believe that, you know, again, overall, it was 22% of households were unable to make rent or mortgage payments in May, but you can see from this chart, particularly lower income households are making fewer payments or doing partial payments just to get by. And then if we're thinking about going into the future, less than half of those surveyed, both renters and homeowners, felt that they could afford their current housing costs for the next 3+ months. So again, we're in this moment of crisis, but what will that look like as we move forward? Another report that we wanted to just share and bring your attention to was from MAPC, their COVID-19 layoff housing gap report. This really helps to see what is the number that we're looking at for really needing to fill that gap. So even with the expanded unemployment benefits, there's still about 7,800 renter households and 77 owner households in Massachusetts who are having trouble paying for their basic needs. That collectively results in $13.8 million monthly to keep up with their rent or mortgage. You know, every single person, when they need that additional assistance, it really does add up. And from their update, again, thinking beyond, you know, when the eviction moratorium is lifted, which has been really wonderful that people aren't being evicted, but if they're still unable to work in August, the situation will become much worse when those benefits end. I think the big takeaway here is that, you know, the average monthly assistance needed is about $935 per renter household and $1,290 per owner household, which is a statewide assistance gap of $195 million monthly. There's obviously a need here that is not currently being filled, and we want to make sure that that's at top of mind when you guys are having your discussions. So in our conversations, and what you're going to do now is go into some breakout rooms. I just want to raise a couple of things. Whitney's going to share in the chat where there are local emergency rental assistance programs happening. There have been a lot of communities that have responded by putting either CPA funds or trust funds or CDBG funds into rental assistance. Obviously, there's additional RAFT funding. But after the moratorium is lifted, after those funds are expended, what are we going to be doing? How are we going to care for our community members? I think Barbara in particular mentioned that people's ability to access funds has been difficult, and Karen mentioned, you know, how do people know that these funds are out there? How are we doing outreach to make sure that those who are most vulnerable, maybe who are doubled up, have the ability to get access to those funds and know that they are available for them, and particularly want to focus on undocumented immigrants. Atel and Gina spoke about this. It's really critical that people who are undocumented know where they can go for assistance without feeling unsafe in accessing those programs. There's been a lot of conversation in this region about the impact on economic development. Mark mentioned, you know, small businesses taking really big hits. Will they be able to recover? Will they come back? What does that mean for people who rely on those small businesses for their wages in your region? Making this connection to housing as healthcare, this is true now more than ever. But how are we going to continue this momentum and move from housing as healthcare just as a COVID response, but into all of these other things that your regional partners spoke about with lead safe and water and sustainability and climate resiliency. Thinking a little bit more about regionalization, we'd love you guys to share your thoughts on that. You know, several folks have mentioned that there's only 3 entitlement communities in this region. So the ability to access some of the federal and state funds is limited. So what would some of the benefits of regionalizing the response be? And we always at CHAPA want to make sure that we're talking about racial equity in these conversations, but in this moment, even more. I think that COVID-19 and our racial equity conversations are just highlighting the, as we've been saying in our municipal engagement communities, it's been the great revealer, that we've all known that there are some communities that are more vulnerable to housing instability, and both COVID-19 and a lot of the conversations around Black Lives Matter have just elevated those conversations. So we want to make sure that's front of mind for all of you. So what we're going to do now is go into discussion groups. I'm going to send you into a breakout room with several other participants. These are the discussion questions. Whitney is going to share that now in the chat, I believe. And so if you look in the chat, there should be a file that you can download. Make sure you download it now prior to me sending you into the breakout rooms. So I'm going to, can someone unmute themselves and tell me if you're able to download that document?
Yes, please. I shared it a few times through the chat, so while Dana was talking. Should see that. I'm just looking for nodding. I don't see any. Abi, are you able to see that?
I am trying to find that file location on my computer.
Okay, I'm going to share it again.
Patel, were you able to get it?
I was just going to say, at least on my end, when I click on it, I just get a prompt that it's been saved as a link versus being able to download it. I'm not sure if that's happening to everybody else.
Yes, so you copy this, paste, go into your browser.
Okay.
If you go into your browser, it will pull up as a on your browser. So folks can try that. Yep, yeah, exactly. You copy that and you paste it into your browser, and you'll be able to see these discussion questions. So here we are. The questions, as you guys are all downloading that, is, you know, where do we go from here? Your top concerns, both for your individual community and your region. Are the state and federal resources that Abi and Ryan were talking about, are they actually helping your community as planned, or are there gaps that you're seeing? What are some potential policies or funding sources you think could solve those issues? What are you grappling with it that you think could use some more attention and support? And then how do you plan to continue to address housing needs beyond COVID-19, and what will you need to do so? I mean, so much of what we keep talking about is the crisis beyond the crisis. Right now we are in this moment, but we know when we start opening things back up, we're gonna have a lot of work to do. So how are we going to get to that? So what's gonna happen now is I'm gonna send you all into breakout rooms. If someone from your group could please take notes, you can submit those to me via email. You can take a screenshot of them. You can snail mail them to me however you want, but please make sure you get them to me, because what we will do with these at CHAPA is compile them, and they will influence our policy priorities. They'll influence our work at the local level, and we'll also be sharing them with our community partners. So I'm about to send you guys into 7 rooms. If you need my assistance, while you're in there, there's a little button you can press that will, you can call for one of the hosts to come and assist you. So here you go. And we'll call you back in about 15 minutes. You have about 15 minutes for these conversations. All right, here you go. All right, folks should be coming back into the main room out of your breakout rooms. I hope it wasn't too abrupt to the end. I know it gives you 60 seconds, but it's always like, gotta say that last thing, gotta hear that last insight from my folks in
it's
my
like a chasing game. Yeah, that's fine.
All right, well, welcome back, everyone. I think almost all of you are back in. We've got just a couple of more folks waiting to come back in. So I want to open it up. I know that was a lot to discuss in your small groups, but before we close, I do want to hear if there were any aha moments or things that you were talking about in your groups that you want to share with everyone. We won't have time for everyone to share, but we do have a few minutes left before we close. So feel free to unmute yourself and speak if there are questions or gaps or things that you thought were really interesting in your small group discussions. It's very quiet.
So no, this is Karen. I always have something to say. So I was just finishing up a comment. I really enjoyed my quick conversation with my group. But one thing that's extremely clear, I believe that all the regulations, all the stuff that people have to go through for paperwork not only is it disabling, but many people don't get it. They don't know what to do. They don't know how to access it. Seems to me access is a key issue that we've got to work on in Worcester County and figure out a streamlined way for everybody to know where to go for what and not have it be so over. There seems to be so many things that just keep shading over each other. And if I was trying to figure it out, separate from being a person that's running the program, it seems to me that we should be able to figure this thing out in the language that works best. And I don't mean language for bilingual. I mean the language that helps people to figure it out fast. Like, the top 20 questions. What do you need to know? Yeah. And I think if CHAPA could help figure that out for Worcester County, and then obviously for all the other regions, I think we'll see more money on the streets. We'll see more people coming forward. I also think we have to not talk about people of underprivileged. I think that this is for everyone now in the Commonwealth, and it's not just about low income. So I think we have to kind of think differently about some of the historical value of these programs.
Yeah, and I'm seeing a nod of agreement in the comments, essentially. Mark saying the same thing came up in his group. Other things that folks, and Ben Roberts says access is not cohesive and not clear. Okay, other folks have comments on that or anything else that came up?
Can I make a clarification, please?
Sure.
So I am accessing Ben Roberts' account. I don't know how that happened, but he registered me. So Ben Roberts is actually Linford Cunningham. So
yeah, I was about to say those were not my words by any means.
Okay.
But I will have them if you will allow. But please, Linford, do continue.
Okay, thanks, Linford. And Ben, did you want to add something?
Oh, well, so building off of access, so for example, I was previously in the position of short-term health navigator for AIDS Project Worcester. And so, for example, the quality of life organization, et cetera, the principle being that there is no wrong front door, that all doors are the right door. I think that might be a matter of getting up on the language and that structuring for all organizations to de-silo in terms of being that front door. But it may also, and this was something that the group that I was a part of discussed, and I would hope that my colleague would be able to expand on this if they feel comfortable. But what was mentioned was the NIMBY effect, or rather the cultural stigma of individuals who are affected by COVID, and now these cultural norms and memes associated with low-income housing, COVID, survivor or person who is dealing with or fleeing from COVID, what type of cultural effect we're going to be seeing in the communities, what types of implications we're going to be seeing in those principalities.
Absolutely. Thank you so much. Anyone else want to share what you were talking about in your group?
I have one thing I want to add, which is that I think we all need to recognize and remember that we have a shortage of affordable housing. We have a shortage of accessible housing, of group homes, of a whole slew of affordable housing. And it's going to take a little traction to get back on track after this pandemic is over with moving the state and local governments forward to more focus on filling those gaps in the affordable housing system. It's not going to go away, and it's certainly not getting better under the pandemic, and I'm afraid that momentum is going to be lost.
Yeah, an interesting point to that, you know, a couple of things there. One is we found in the communities that have our municipal engagement initiative, they've been able to keep pressure on that front, even in the midst of COVID-19. So it speaks to the value of having a local affordable housing coalition. But also what we're finding is that COVID-19 is raising up the issue of housing being so I mean, we all believe it. We're part of these conversations. Housing being just a fundamental right and something that is so necessary. It's starting to get into the broader conversation. And so taking that momentum and taking it past the coronavirus pandemic into our efforts to create more affordable housing is something that we've been talking about. We have a group that meets once a month called Making the Case for Affordable Housing. If you're interested in joining that group, you can reach out to myself or Whitney. We're going to share our contact information after this, but we're also on the CHAPA site. We're having these kinds of conversations about how do we keep that momentum, knowing that we already had a shortage of affordable housing prior to this moment. How can we keep doing the work and actually use the newfound interest people have in housing affordability and turn it into some more advocacy. So we're coming up against the end of this time. I'll take one or two more comments and then I'm going to close it up. Any other burning thoughts? Etel, please.
Thanks for that recap, Dana. I also want to remind everyone and also, you know, keep us thinking about that it's not just about housing. It is about advocating any chance we have development projects coming into our community that people get paid more than $15 an hour, that people have access to good paying jobs, that, you know, livable wages for families. And I also think that when we talk about homelessness, that we don't separate individuals and families, that yes, both groups need a different type of response, but that we need to have a holistic look at making sure that we're not focusing on just one or just the other, but that we're seeing it as a universal problem. You know, it's our communities and we need to take care of everybody.
It's a great point. Thank you. And so much of this work is about bringing multiple voices. And I really appreciate all of you being here. I will remind you all again, please, whatever notes you took in your small groups, please share those back with us because we do really want to hear from you. So I'm just going to very quickly share my screen again to give you a couple of things to close out. Can you see this?
Yes, we can see that.
Yes.
Okay, so please get involved with this. Can you see the Join a CHAPA Committee page? Is that what you're looking at? Yes. Okay, great. Sorry, it's hard to see what you're all seeing on my computer, but please, as Abhi mentioned, join one of our committees. You can find out all about those on our website. Attend one of our forums. We have been doing a lot of them virtually, and we will continue to do so. We also have, you know, a lot of them we've been recording, and they're up on our website. So if you're interested in local emergency rental assistance programs or RAFT, you can go to our website and you can view recordings of those there. And then you can go to our website for all of these things to register. We have our monthly housing briefs, to join our committee, to engage locally through our municipal engagement initiative. There is a link on our website to tell us where you live, then we can connect you with efforts that are happening locally. And we also have our annual dinner coming up this fall, so please stay tuned for more details on how we will be doing that in this social distance world. And just lastly, I want to thank all of our co-sponsors and Bank of America and share contact information for all of us at CHAPA if you have any questions or comments or strategies that you'd like us to be looking into. Please do not hesitate to reach out to us.
Dana, can you just give us the date in October, just as a hold?
For the CHAPA dinner, it's gonna, I believe it's October 22nd. Can someone else from CHAPA confirm that for me? I will double check.
I can't hear a word.
It's all right, never mind.
You can't hear it? Okay. I believe it is October 21st, Jenna said. I'm sorry, I was a day off. October 21st is the date. We will be sharing additional information on what that will look like. We are hopefully going to be
in person,
gathering in some way, and gathering stories of the hard work you all have been doing in this moment. So if you have things like that you'd like to share with us, please send them to us as well. We'd be happy to highlight that at the dinner. And I think that's it. Anything I've missed, Whitney, or anything else I can do for you all?
No, I think you captured everything. Thanks.
Thank you so much, everyone, for joining us. And like I said, before you leave, save the chat. You'll get all those links to take with you.
Thanks so much, everybody.
Bye.
Bye.